Welcome back. It's been reported that South Africa could take delivery of its first batch of coronavirus vaccines by the middle of next year. This is part of the Covax initiative, spearheaded by the WHO to ensure access to low-income countries as well as rich nations. The Solidarity Fund has agreed to make an initial payment of 327 million rand. The total cost of the vaccines would amount to much higher, though. To discuss, we're joined by Professor Barry Schoub, who is the chair of the Ministerial Advisory Council on COVID-19 vaccines. Professor, thank you very much for being with us. Explain how it works, because the UK is set to roll out a vaccine as early as this week. Why do we as South Africa have to wait until the middle of next year or so?
Yeah, thank you for having me. I think there are many considerations. The consideration to buy a vaccine or purchase vaccine for the country really needs a lot of consideration. There are many factors we need to take into account, and specifically factors which relate to the vaccine being suitable for our conditions. To give you an example, the one vaccine which has been licensed, for example, in the United Kingdom, the Pfizer vaccine, requires storage at very low temperatures, at ultra low temperatures, -70. We don't have those facilities for most of the country. And there are many other issues that we need to really examine very thoroughly before we make a recommendation which vaccines to buy. Yeah. So we've gone into that, our Ministerial Advisory Committee. We have a number of work streams which are looking at the vaccines themselves and looking at which population groups to start off with, because obviously we won't have enough vaccine to start off with for the whole population.
Okay, at least there is likely to be more than one vaccines. There's several in sort of final trials. Otherwise, it sounds like we'd be left out in the cold in a sense, because we wouldn't be able to buy the Pfizer vaccine.
Well, yes, there are many vaccines. There are 11 vaccines which are on the phase 3 trials now. Pfizer is the only one which has been licensed, but there are 11 which are probably about to be licensed very soon. So you will have a choice, and there are different, what you call, platforms or designs of vaccines. Some vaccines might only require 1 dose instead of 2 doses. Some vaccines only require refrigeration temperature for storage. So these are all the factors which make it very advantageous or specifically suited to our population. So we're paying Covax,
but you're saying that'll enable us to access a myriad of vaccines down the line. Is that correct?
Yeah, I think Covax itself will present a bouquet of vaccines, not just one vaccine, and we will then need to choose which one is suitable for our needs. There are also bilateral negotiations going with vaccine manufacturers as well as Covax. So we will kind of spread our ability to choose vaccines relatively widely.
For people who are a bit confused, the Covax, the idea behind this is sort of equitable access. Explain how it works.
Well, the way it's a pooled procurement mechanism. In other words, it's the advantage of having many countries. In fact, 189 countries so far have signed up to Covax, and you've got probably about 75 or 80% of the world's population. So it's a large bulk of the purchasing power, which will now compete with the wealthy countries who have bought up a large chunk of the vaccine which has come from manufacturers. So it's really that pooled procurement power which will allow vaccine access to vaccines coming to, as you said, the middle and lower income countries.
And there's been some confusion about our payment. The finance minister said a payment had been made, then it was reported South Africa had missed an important payment. In your mind, does the Solidarity Fund payment mean that the matter is at least sorted now?
Yes, the matter is sorted. Covax had set a number of conditions down, including the initial deadline, and we need to really kind of see that these conditions can be satisfied and that they are suitable for our needs. So there were various negotiations which were going on between our Treasury, and Covax to satisfy those conditions. But we are on Covax, and we will be part of Covax, and we will get our vaccine through Covax.
Yeah. This means that we'll get some drugs. They're being channeled through this pooled body, so presumably there are limits, though. Are we, and should we as South Africa, be bidding directly to the manufacturers of the vaccines as well?
Sorry, I didn't get that. Should we be?
Beyond Covax, should we be lobbying or bidding actually for vaccines?
Yeah, I think so. Yes, we will probably look. It does also depends on the cost of the vaccine and what we can afford. So Covax will be supplying up to 10% of our population, which is the high risk groups. The kind of funding for additional vaccine requirement will really depend on Treasury. Ideally, yes. We are still negotiating and we're still interacting and communicating with other vaccine manufacturers to also supplement Covax. But that, of course, will also depend on what the country can afford. Yeah. We don't have the same deep pockets that the United Kingdom and USA and EU have got.
Well, I guess, can I ask you, has South Africa been fighting for its citizens here? Do you believe that?
I do believe that. I mean, we are within the constraints of what the country can afford. I mean, we are going to have our initial tranche of vaccines, which also the high-income country is going to have. No country will start off with immunizing its entire population. It will start off with what we call selective vaccination of the high-risk groups. Later on, as more and more vaccine come off the production line, because you must remember, making vaccines is a lot more intricate and a lot more demanding than making a tin of baked beans. So, sure. Everyone will kind of wait until there's sufficient amount of vaccines being produced, initially for selective vaccination of high-risk groups, and then universal immunization. Obviously, the higher income countries will get to universal immunization well before the middle and lower income countries, but we will get there eventually.
Final question. I mean, right now you can go for a COVID-19 test in a public facility or in a private facility. Will the private companies themselves be in on the action bidding? Will you be able to go and get a vaccine if you're on medical aid?
Yeah, that we don't know at this stage. I think it's really a matter of numbers. In other words, the government is obviously a very much larger bidder of vaccine. What the private facilities or private sector can acquire in terms of amount of vaccine, we really don't know at this stage, because there's obviously a limit to the amount of vaccine which manufacturers can produce. Those will obviously go to countries rather than private institutions. What the private sector can negotiate, we really don't know what's going to be available for that sector.
All right, very interesting, a little bit complex. So what we do know is that Covax, this shared sort of platform with purchasing power, through that we will get vaccines sort of looking at the middle of next year. That was Professor Barry Schoub, Chair of the Ministerial Advisory Council on COVID-19 vaccines. Thank you very much.